into the dining, sanitize my hands, grab the meal card. Make sure this is for Hazel. Her room number, everything is written on the card. I'll compare what's on this card with what's on the trade. Everything looks good. I'll grab my supplies. Including the wipes. Most likely she has it in her room there. Grab the tray and head straight to Hazel's room. Good morning, Hazel. This is Theo, your nursing assistant. I brought your breakfast. Are you ready to eat, Hazel? Hazel says, yep, she's ready to eat. Provide privacy and take away the call light. I'm gonna raise her hair up so she sits in an upright position. This is the key step. Keep pressing this button until the head of the bed can no longer go up into the half phallus position, like somebody sitting in a chair. Know your key steps. I put on my gloves. I'll grab a chair. Always make sure you grab a chair and sit. I'll grab the clothing protector and place it around her chest so her clothes won't get dirty. Okay, so for breakfast this morning, we have our milk, water, and juice. Milk and orange juice. We also have our mashed potatoes and gravy. There's big chicken, and I see fruits and vegetables. What would you like to start with first, Hazel? Hazel says she wants to start with mashed potato and gravy. I'll clean her hands, both hands. Make sure you wash their hands or clean their hands before you start to feed them. I'll mix up the gravy with a little piece of chicken. I'll feed Hazel. I'm going to observe Hazel to see how she's chewing and swallowing. If I notice any difficulties, I will let the charge nurse know. But everything is going good. What would you like to drink, Hazel? She says she wants to drink some milk. Give her a little sip of milk. At this point now, I'm not going to be asking her what's next, but I'm just going to make sure I grab every little item on this tray as I feed her so that she'll be able to get all of her nutrients. I'll be alternating between solid and liquid, grabbing every little piece of everything on the tray as I feed. Hazel says she wants some water. Give her a little water to drink. I will continue in this fashion as I'm feeding her solid and liquid. And then Hazel says she's full. She says she's all right now. I'm gonna go ahead and clean her hands again before and after. Make sure you clean their hands. I'll grab the clothing protector and wipe her mouth. It is perfectly acceptable to do that. And I'm just going to remind her, hey Hazel, can you please remain in this position for about 30 minutes to allow your food to digest, okay? I'll be coming back later to check on you. Please do not lower the head of the bed. I give her back her call light. Open the privacy curtain. Is there anything else you want me to take care of, Hazel, before I leave? Gloves to gloves, skin to skin. Remember, you are in her room. You cannot leave the room with gloves on passing through the hallway to come all the way to the dining. Take off your gloves. Sanitize my hands. Grab all these dirty items and go back to the dining room now. Come into the dining area. Put the dirty clothing protector in the basket that they have right there in the dining room and put this to where the dirty trays are. Sanitize my hands again. Rub it all over until the sanitizer is dry. Done. Feeding. Any questions?